Good afternoon, everyone, and thank you for joining us today at the Women's Health Summit. I am Dr. Rafael Ortiz, Chief of Neuroendovascular Surgery and Interventional Neuroradiology at Lenox Hill Hospital, and Associate Professor of Neurosurgery, Neurology, and Radiology at the Zucker School of Medicine. I would like to thank the 92nd Street Y for organizing this Women's Health Summit and the Katz Institute for Women's Health and Nancy and Larry Roth for helping to make this event possible. June is Alzheimer's and Brain Awareness Month. More than 5 million Americans currently live with Alzheimer's disease and dementia, and more than two-thirds of them are women. A woman's lifetime risk of developing this condition is 1 in 5. But once women reach their 60s, they are twice as likely to be diagnosed with Alzheimer's disease than with breast cancer. Why are women more vulnerable? We're still trying to figure that one out. On average, women live 6 to 8 years longer than men, which may account for some of the risks. But there's strong evidence that sex also plays a leading role. You cannot change that. You cannot stop the aging process, but you can make little choices to safeguard your mind and your body. Today, you'll learn how to boost your brain health by maintaining certain healthy lifestyle habits that are good for both your body and your brain. We'll hear from Kelly McGonigal, who will discuss the connection between the brain and body, as well as award-winning journalist Joan Lunden and Lynn Posluns from the Women's Brain Health Initiative. A panel of Northwell Health experts will speak of aging gracefully and outline what's normal and what isn't normal in the aging process. We will also talk about the importance of sleep and share what all of us can do to promote brain health.
I am not a morning person, but this morning, like most mornings, the first thing I did when I woke up was I put on the exercise clothes that I had laid out for myself the night before. And I went to the fridge and got the cold brew coffee I had prepared the night before. And I did a workout. I did a cardio kickboxing workout. And that is because I'm a psychologist who believes that the best thing that you can do to support your mental health, your emotional well-being, and your brain health is to move your body. So today I'm going to share with you a few ways that moving your body can help your brain. And I want to start by saying, I am talking to you. I'm talking to you even if you think you don't like exercise, even if you have challenges to movement, even if you have Parkinson's disease, or you're in a wheelchair, or you struggle with things like depression or grief. What I'm going to talk about today doesn't require losing weight. It doesn't require being a certain age. It doesn't require being a type of athlete. It just requires that you move your body in any way you can, and hopefully in ways that you enjoy, or that bring you a sense of satisfaction or meaning, or that put you in places that inspire you, or that help you spend time with people and communities you care about. So the first idea is the brain chemistry of movement. And when you move your body in any way that uses some muscles, that gets your heart rate a little bit, or that requires you to breathe more deeply or fully or quickly, you are going to get a change in brain chemistry that makes you feel better. It starts with dopamine and adrenaline, which give you energy and make your outlook more positive. And as you continue to be active, your brain releases endorphins and endocannabinoids, which are brain chemicals that relieve stress and anxiety and really enhance positive emotions. And in particular, these are brain chemicals that enhance our ability to take joy and meaning in connecting with others, whether that's through conversation, collaboration, caring for others. These are brain changes that you see no matter what form of movement you're doing, walking or running or playing sports, flow yoga or dancing or lifting weights or boxing, whatever works for you, whatever you enjoy. And here's the really interesting thing. First of all, there's no dose too small to get some of these benefits. So you will get that dopamine and adrenaline in a couple of minutes of any type of movement, any intensity. You'll get even bigger changes in brain chemistry if you persist about 20 minutes, maybe 30 minutes of, again, any activity that gets your heart rate up a little bit, that gets you moving. And those changes in brain chemistry, even if you only do the smallest dose, appear to improve your mood and your energy for hours afterward. And it's one of the reasons why on days when people are active, they are more likely to report making progress on an important goal to them. They are more likely to report having positive interactions with other people, like family and friends. And they're also less likely to experience a major decline in mental well-being due to stressful life events. So let's say you do go for that walk in the morning, and then you have a really difficult conversation, or you get some bad news. You will actually experience less anger or despair or worry than if you hadn't been active that day. These changes in brain chemistry, they really make us a better version of ourselves in a way that allows us to face the challenges of the day and to go into those roles and relationships that we care about, braver, better able to connect, more optimistic. So I encourage you to embrace movement as a way to reset your brain, reset your outlook, and whatever form of movement you can do and want to do, you can get that benefit. All right, here's the second idea. And this has to do with how the brain adapts to movement over time. So now you know that if you do cardio exercise over time, over weeks, it strengthens your heart. And if you lift weights over weeks, it strengthens your muscles. It actually changes the structure of your muscles, of your heart. Well, the same is true for your brain. And the clearest way that any form of being active changes the structure and function of your brain over weeks is that it makes your brain better at experiencing positive emotions and positive motivation. All of those brain chemicals of the exercise high that you get from doing a single activity session, over time it teaches the brain to give you those brain chemicals on a regular basis every day and in response to all sorts of experiences, whether it's pursuing a challenge that's meaningful to you, whether it's caregiving for others, whether it's enjoying a delicious meal or something that you find beautiful. Your brain learns to better create for you motivation, happiness, joy, and meaning. And you can see these changes unfolding in the reward system of the brain in the same way that you could identify changes in your muscles from lifting weights or changes in your heart and your blood vessels from cardio training. Now, as I said, this takes weeks to kick in. And this is also why sometimes people who haven't been active don't experience a huge exercise high the first few times they work out. The brain has to learn how to reward you for movement to get that high. And it's that increase in pleasure and meaning that you derive during and after exercise that is often a sign that your brain is changing in ways that will make you happier throughout the day and in all of your life. This is one of the reasons why, by the way, that exercise is considered a really effective support for treating things like depression, trauma, grief, and addiction, all of which are include changes in the brain that make it more difficult to experience positive emotions, motivation, and connection with others. So, as I said, all form of movements can support this, all activities. And if you can find a way to commit to being active for about 6 weeks, seems to be a magic number, you can move your way into, basically remodeling your brain in ways that will make you more responsive to joy and more motivated for your own life. So I would encourage you to think about how you might be able to commit to movement for 6 weeks if you're someone who's just getting started. Maybe you sign up for a program or sign up for a series of classes. Maybe you say in your own mind that in 6 weeks, you're going to do some milestone activity, like you're going to dance at a wedding, or you're going to go for a 5K walk in your favorite park. And you imagine yourself as training for that 6-week milestone moment. And I also encourage you to really look for those activities that you enjoy or that put you in places you love, like being outdoors, or that help you spend time with people that you care about, because all of these things will enhance your brain's ability to reward you for being active in ways that ultimately strengthen some of these amazing transformative effects that exercise can have on your brain health. All right, so there's one more idea that I want to share with you. And this, I think, is the most exciting scientific discovery of the past decade. And this is the insight that your muscles manufacture proteins, chemicals, molecules that they release into your bloodstream that affect every system of your body, every organ of your body, including your brain. So some of these molecules that your muscles manufacture, they kill cancer cells. Some of them boost immune function. Some of them support your heart health. Some of them regulate blood sugar. But a whole lot of them actually make your brain healthier and more resilient. And your muscles release these chemicals into your bloodstream when you move. It's muscle contraction. It's physical activity that unleashes this amazing capacity that you already have to support your own health, including your brain health. Now, some of these chemicals, there are dozens of them. They're called myokines. Some of them really target what we think of as age-related changes in mental capabilities, things like memory and learning and emotion regulation. Some of them can prevent or slow down Alzheimer's or Parkinson's disease, but many of them also are really more targeting mental health. So making the brain more resilient to stress, better able to recover from things like trauma or depression. In fact, some of these molecules basically act like antidepressant medication or anti-anxiety molecules. In fact, one of the first research teams to identify how the muscles release these molecules through exercise dubbed them hope molecules, because of this observation that your muscles can put molecules into your bloodstream when you exercise that create hope or that sustain your capacity to hold hope even when life is incredibly difficult. And I will tell you, this is a mindset that really helps me get up in the morning even more than the cold brew coffee in my fridge. You know, I will tell myself that I'm getting out of bed to give myself an intravenous dose of hope. And I think that's such an empowering way to think about movement. That movement isn't about making up for something you enjoyed eating yesterday. It's not just an investment in warding off health outcomes you're trying to avoid. When you move your body in any way that you enjoy, that you can do, you're actually tapping into your body's natural capacity to support you, to give you hope. I think that's just an incredible way to think about exercise. So I hope that you heard something today that you can apply to your own life. And I encourage you to share something you heard with someone you care about, because we know that is one of the best ways to turn an idea into a commitment in your own life, to share that idea with someone you care about. And that really helps it take hold in your own mind and heart and body. And I encourage you, again, to move in any way you can. To start today, you could put on a song you love and move in any way that you feel inspired to. And know that in as little as a couple of minutes, you're going to begin to access these amazing capacities that are a gift, and you'll begin to create your own joy of movement.
Why is sleep important? It's when your body has a chance to repair and replenish. Even your brain appreciates the chance to cleanse itself during sleep. Not getting enough quality sleep is risky for many reasons, including immune system suppression. Sleep problems are often the result of what we call poor sleep hygiene. So here are some tips on what you can do to enhance the quality and duration of your sleep. Be consistent with your sleep and wake times. And when should you go to sleep? Ideally, within an hour of when you first start to feel tired. Many adults think that's too early, but we're actually hardwired to sleep in the dark and wake with the light. Unfortunately, thanks to the advent of electric light, we began staying up until all hours, ignoring our natural sleep-wake cycles. Keep your bedroom temperature cool, about 65 degrees Fahrenheit. Cool temperatures really do help us sleep better. If you're skeptical, think about how well you sleep in air-conditioned rooms in the summer. Cool ambient air promotes sleep. Worried you'll be too cold? That's where pajamas and comforters come in. And many people find that wearing socks to bed is helpful. But make those socks non-binding and of a natural material like cotton. Researchers think that wearing socks to bed, warming the feet, may lead to an internal body temperature drop and good sleep. Keep hydrated during the day, and that will help you sleep better. It's true. When you are well hydrated, you are less likely to awaken in the night. But don't chug down a gallon of water right before bed. Drink water throughout the day. Water is your friend, and no heavy meals late at night either. That can also interfere with sleep. Exercise is key. Every day, plan on getting physical activity. Most of us don't move around enough. Routine exercisers have far fewer problems achieving quality sleep. A little exercise goes a long way, and exercise also helps set your body into consistent wake-sleep patterns that are so important. But remember, exercising right before bed isn't a great idea because exercise energizes you. So what you want is to relax in the hour before sleep. This is when you should limit yourself to quiet, non-exciting activities. And please, no electronics at this time. Electronic light, yes, that means your cell phones too, can be enough to upset your sleep-wake cycles. Avoid daytime napping for too long or too late in the day, no more than 20 minutes tops, and no later than early to mid-afternoon, or you may find your sleep that night will be disrupted, leading to daytime sleepiness the next day, more napping, and a vicious cycle of daytime napping and nighttime insomnia ensues. Turn your bedside clock away from you, not only so the light from a digital readout won't be disturbing, but because if you do awaken at night, fixating on the clock may keep you from falling back asleep. Don't worry, your alarm will ring even if the clock isn't facing you. And if you keep to consistent sleep-wake times, you may find you don't even need an alarm clock eventually. Practicing relaxation techniques before bed can also be helpful. Deep breathing is a great way to reduce stress levels. You might also like progressive muscle relaxation or guided imagery to get you off to dreamland. Still have problems with sleep? Consult with your physician about getting a referral to a sleep specialist who will be able to evaluate your specific situation. Wishing you pleasant dreams and refreshing sleep.
Hi, I'm Dr. Maria Carney. I'm delighted to be here with my colleague, Dr. Jeremy Koppel. We work together, we refer patients to each other, and I consider him a wonderful colleague. So I'm delighted to be here to talk about optimizing female brain health. I like to start when I present with a case, and I have a case of a 64-year-old woman that came to my office. I see patients in New Hyde Park, affiliated with Northwell and the Zucker School of Medicine in the geriatric medicine office. This patient, 64 years of age, an accountant, high functioning, and she had an episode of losing her keys. She has a significant family history in that her mother has dementia. She's married, has 3 adult children, and 1 sister. So this episode created a lot of fear and anxiety for her. And what she had questions on what this meant for her. So first and foremost, I just want to say that memory lapses are not all equal. We can have them. It does not necessarily mean that you have a fear of dementia that many people are concerned about. And forgetfulness can be a natural part of aging and memory, but we can do things to decrease memory loss. So I want to go through that. And how we remember, let's discuss that. In order to create memories, we have to acquire the information. So hearing is important, being able to be focused on hearing the information, consolidating that information into the brain, and then again, retrieving it from the location in the brain. So acquisition of memories, consolidation of memories, and retrieval of memories is how we create our memories. So there are tips for remembering names and faces that are an example of this. Repeating somebody's name during a conversation. If somebody comes up to me and says, "Hi, my name is Stacy," I will repeat it. I will say, "Hello, Stacy. Nice to meet you. You know, you remind me of somebody." So that helps you connect a person with a look and their face. And then you can ask the spelling of their name. How do you spell the name? Stacy, S-T-A-C-Y. No, it's S-T-A-C-E-Y. And then you use the name when you say goodbye. Goodbye, Stacy. Very nice to meet you. So these are examples of acquiring the information, consolidating the information, and retrieving it and helping that process. But there are some normal flaws of memories. People can forget and have real reasons for forgetting, and it does not mean that you have a memory disorder necessarily. There's transience, which means that if you don't use the memory, you lose it. If you don't use a phone number regularly, you'll lose that ability to retrieve it. Absent-mindedness, inability to focus on something, means you're not able to consolidate the memory. There's a blocking flaw of memory where you have that memory, it's on the tip of your tongue, you know it, but it's just not able to be retrieved or come out. But it may come out later at another date or time. Misattribution of a memory. You have the right memory, but the wrong person, the wrong source. So it's a little bit flawed memory. Suggestibility. Memory is vulnerable. It can be edited by a power of suggestion. If somebody tells you a memory or an event that they were at and they remember it one way, but you remember it a different way, your memory may change. And then there's a bias, recalling a past relationship. You may recall a memory of a past relationship much differently than another person. So there's bias in memory. And persistence of a memory that you can't let go of. So in some people, it's inability to retrieve it, and other people, there's a memory that's obsessing you and you can't relieve it. So these are normal flaws of memory and does not necessarily mean you have a dementia. And we all age from being a baby to an adolescent to a young adult, and then in adulthood, we continue to age. This is called aging physiology. There's a normal transition that occurs with adulthood. And the same is with our organs. There's aging physiology, and this happens with our brain. And this is very preliminary research that was done in the 90s that showed the decrease in body function, organ function. One of the first studies was in the kidneys that showed maximum kidney blood flow was at age 30, and that decreased with age. And we've over the years come to learn the same with pulmonary function, heart function, the water content in our cells, and nerve conduction velocity. There's a normal aging physiology that occurs every decade of life. And what can we do to maximize this physiology, protect or slow down this physiology is important. So nerves, neurons are impacted with normal aging physiology. And how does memory change with age? Well, the hippocampus in our brain shrinks over time, and that's our central coordinating center of memory. Neuron numbers decline with age. It becomes harder to acquire memories, harder to consolidate the memories, harder to retrieve. And the processing slows with age. So our central command center has difficulty giving air traffic control of the memories in our brain. What contributes to forgetfulness? Well, it doesn't mean it's just you're having a disease or a problem. Forgetfulness can be worsened by multitasking, stress in your life, lack of sleep. Perhaps medications you're using can affect your increase forgetfulness. Illnesses and alcohol use. These are all contributors to forgetfulness. But the really big question for my patient that I saw was, how can she prevent memory loss and how could she decrease risk for dementia? So there's a lot more information about risk reduction of brain function. So you don't hurt your brain function and you maximize your memory over time. And this is thought to be somewhat of how we look at memory across a continuum. Where you're healthy cognitively functioning, you may have pre-symptomatic issues with memory, where you may have cellular changes in your brain, but you're not presenting with symptoms. And then later on, you might have mild cognitive impairment. We're not sure if this is going to lead to a dementia or not, but then later you may develop a dementia, and I'll get into that, what that means. So this is a memory across a continuum. Risk factors we can affect. Risks for dementia include age. The longer you live, the likelier you may develop dementia. Your family history, genetics, the environment you live in affects your education level. If you've had any brain injury, whether that be traumatic brain injury or inflammatory illnesses that affect the brain, your nutrition, how healthy you live and eat. And then again, illnesses that may affect the brain, whether that be infection, circulatory, diabetes, head trauma, mood disorders, hearing loss can affect your memories and contribute to an increased risk of memory problems because you have difficulty acquiring the memory. But there are some protective factors we know, things that can protect you from developing dementia by protecting your brain. Wearing helmets when you go skiing, wearing a seatbelt, preventing falls, exercising your body, helping the circulation, also exercising your brain, being educated, reading, doing crossword puzzles, being moderate use of alcohol. Some medications have shown to be somewhat protective on brain function, such as cholesterol-lowering medicines. It helps the circulation and prevents micro injury to the brain. There's been some hints that there may be a role for hormone replacement therapy. We're still not sure about that. There's some hints that having anti-inflammatory medications can be helpful to preventing dementia developing, and there'll be more studies and research coming out on that. And our nutrition, as I mentioned, and your sleep can be protective. So getting to protecting your head, we know this by if you look at the NFL, 6.1% of NFL players who are over the age of 50 had a dementia-related diagnosis. That's 5 times higher than the non-football players. So we think that injury to the brain contributes to development of dementia. We also know that there's a heart-brain connection, hypertension, and the evidence of subjective cognitive decline. And you will see where there are higher in this map, that where there are higher levels of hypertension, there are also higher levels of subjective cognitive decline. We know that there is a heart-brain connection. We know this also from the Framingham Heart Study, that those involved in this heart study over time from 1975 to 2015 had a lower incidence of dementia. So by being involved in your heart care, hypertension, evaluation has been associated with lower dementia prevalence. We know this about Exercise, the study of women who walk, those who in the highest quartile of walking had the lowest incidence of dementia development. We also know the Nun study, which looked at, it was a longitudinal study of nuns, and they compared individuals who had educated, compared their education level and their study level, low idea versus high idea persons, and they showed that those with low idea and lower education had higher incidence of dementia development over time. Drinking wine moderately, the nurses' health study. Moderate drinkers had better cognitive scores than non-drinkers. 20% lower risk of cognitive impairment in drinkers. So if you're drinking moderately, 2 glasses a day or less, really 7 glasses per week is the max, you have some protective of your brain, properties of your brain. Eating healthily. A healthy brain diet includes moderate caloric intake to avoid obesity, use of antioxidants, high foods and antioxidants, such as blueberries is an example. The Mediterranean diet, having a diet of fish, olive oil, avoiding animal fats, and eating low glycemic index carbohydrates. Fettuccine is a lower carb pasta, for example, than other pastas. So eating a healthy brain diet helps protect the brain. Sleep, 8 hours of sleep a night has been shown to affect in a positive way all of these factors: depression and anxiety, heart disease, cancer, fertility, chronic pain, immune defenses, diabetes, obesity, alcoholism and addiction, and cognitive decline. Sleep is increasingly a protective and important part of our health. So there are memory problems, and some are worrisome and some not so worrisome. So let me go through the not worrisome. If you're independent and high functioning and it's not impairing your function, then don't be worried about the memory loss. If you're recalling events, it may not be right then, but later, that's not worrisome. If you're not getting lost in familiar locations, that's not worrisome. Occasional difficulty finding the right word, no trouble holding a conversation is not worrisome. And your judgment, if your judgment is the same as always, that's not worrisome. But on the opposite, if you're seeing that your function is impaired, you're having trouble recalling any events, you're getting lost in familiar environments, you're having trouble finding words, or you're misusing words, or your words are garbled, or you're repeating yourself, or a loved one is, then that's a little bit more worrisome. And your judgment, if you're having trouble making decisions or your judgments are poor and that's a change, then that is more worrisome for dementia. There are many types of dementia. That's the number one question I get. What is dementia and how does it compare to something like Alzheimer's or vascular dementia? Well, dementia is the umbrella term. Alzheimer's dementia, vascular dementia, Lewy body dementia are types of dementias. And Alzheimer's and vascular and Lewy body are the 3 top types of dementia in the United States. And if you or a loved one have memory concerns and you feel you may have a dementia, I've been told, at any point, you have to make a plan. You have to make a plan out about your care. Who's going to care for you? So who will help you? Where will you live? Who and how will you get the care you need? So you should be discussing this, whether you're high functioning now or you have real concerns or you have concerns about someone you know. Try to create a plan for caregiving. So I'm coming to the end now to bring it together is my patient was high functioning. She was independent, but she was highly concerned because of her family history. And I had to reassure her. I was able to do a full analysis. I did not feel she had memory problems. We did highlight that there was a lot of stress in her life. We gave her guidance and support as a caregiver to her mother to help her through this time. And we try to educate her how to protect her brain and prevent memory loss. She came to our office at 410 Lakeville Road in New Hyde Park, and we provided care to not only her, but also her mother. We work closely with our neurology and psychiatry, neuropsychologists, and research team here at Northwell, the Feinstein Institute. We work together to get the resources needed and to help our patients. So in summary, it's important to eat healthily, drink moderately, stay active physically and cognitively, make efforts to protect your brain and those of your children, right? This is over time as we're aging. Sleep properly, try not to be distracted, listen, be engaged, and get rest. I want to thank you. And Dr. Koppel, it's always a pleasure to work with you.
Dr. Carney, thank you so much. It's always educational to listen to you, and it's great to work so closely together. I have to say, the fettuccine update is important. I didn't realize that was the healthiest. I think I'm a fettuccine Alfredo fan. I've been laying off, but it's time to go back and revisit that. I'm Jeremy Koppel. I am one of the geriatric psychiatrists in the Zucker Hillside Hospital and also an Alzheimer's researcher at the Feinstein Institute. And yet Dr. Carney and I work closely together, refer patients and do research together. And I want to talk a little bit today about a specific part of what Dr. Carney was referring to when she spoke a little bit about dementia prevention and the importance of sort of investing in health, cerebrovascular health, cardiovascular health. And I want to talk about a particular methodology that we have been developing at the Feinstein in coordination with the Bristol Assisted Living, a study called Muscles for Memory. And as a focus here on with women in mind, of course, is the focus of the symposium here. I want to talk about specifically some of the highlights from the participation of the women in the study and how important I think it is as we age, and especially for women, to invest in strength and building skeletal muscle as we get older. So why fitness? I mean, you don't really have to sell fitness. So I don't think that I'm going to have to make a big push for why it's important to participate in exercise programs and get strong and healthy. Everybody knows that that's important. But specifically for dementia prevention, fitness reduces lots of cardiovascular risk factors, right? So we know that high blood pressure, cholesterol, high blood sugar, inflammation, these are things that increase the risk of dementia over time. And getting to the gym and exercising are things that reduce blood pressure, reduce elevated lipids, improve insulin sensitivity, lower blood glucose levels, reduce inflammation. Exercise also, though, does some things that are specific and maybe better known in the scientific community than in the popular culture. And that is that exercise promotes these body-brain messenger molecules. And in the exercise science world and in the neurophysiology world and certainly in the dementia world, we know these things by their acronyms: BDNF, brain-derived neurotrophic factor, and IGF-1, insulin-like growth factor 1. These are things that are produced both in the brain and the periphery in response to exercise that promote repair. And they promote repair of the brain, and they promote repair and growth in the periphery. They also promote something called neurogenesis, which is important for maintaining memory. And they may actually be important to prevent or even possibly treat the primary pathologies related to dementia. They may be important at fighting the amyloid and tau proteins that you may have heard of that build up in Alzheimer's disease. And they may influence the activity of inflammatory molecules that also may promote some of these bad actors, these amyloid and tau proteins that build up and deposit and aggregate in dementia syndromes. So with women in mind, I think it's important to talk about frailty, because when we talk about the risk of dementia in women, we know that frailty is a major risk factor, and frailty is modifiable. And what frailty refers to is deficiencies in mobility, balance, strength, motor sequencing, motor processing, failed nutrition, failure to thrive, and physical activity that becomes people that become incapable of participating in moderate physical activity. That's sort of the spectrum of frailty. So it's sort of a mixed sort of motor, and it has cognitive components. So that people that are frail also typically have impairments in cognitive tasks that involve sequencing and speed of processing. So frailty is a syndrome, and you know it when you see it. It's the 82-year-old woman that comes into your office who's 85 pounds or 100 pounds, very thin, and sort of hunched over. When you ask to stand on one foot, lots of trouble with balance, lots of trouble carrying things. So this, unfortunately, is due to the loss of skeletal muscle mass that happens with age. A third of muscle mass is lost between age 50 and 80. That's a condition known as sarcopenia. And sarcopenia, this loss of muscle mass that leads to this frail, imbalanced, cognitively impaired syndrome, especially in women, is the result probably of loss of motor neurons. This is what happens with age. There's some loss of motor neurons. These are communications from the central nervous system to the muscles, and reduction in sort of hormone protein mediators like insulin, like growth factor 1. So the question is, what does that mean in terms of risk for dementia? Well, it turns out that research suggests that over about a decade, each 1 unit increase in physical frailty, when you rate this composite syndrome of sarcopenia, of muscle wasting, of balance impairment, when you rate that quantitatively, you get a 63% increase of mild cognitive impairment, the precursor to Alzheimer's disease, with every 1 unit uptake in a comprehensive frailty rating. It's pretty scary. Now, it turns out that lower extremity muscle strength has been independently associated with an increase of developing Alzheimer's disease. So the consensus in the field is that something is happening. The lower extremity happens to be where the human being has the most muscle mass, especially the posterior chain in the legs, the glutes, the hamstrings. That's where a lot of the muscle begins, and that's where we lose it over time, in addition to the upper extremity. But the idea is that the reason we think the loss of muscle strength in the lower extremity is increased risk of Alzheimer's has to do with this sarcopenia and this frailty syndrome. So we have been looking into ways of protecting people from the syndrome by investigating strategies to promote brain-derived neurotrophic factor, which is a protein that promotes neuroplasticity and neuroprotection, and is something that's produced in the periphery and the brain in response to exercise. In addition to insulin-like growth factor 1, it's another protein that looks a lot like insulin. It's not insulin, but the molecule is from a chemical perspective, from a molecular perspective, is similar, but it's a protein that's produced in the liver in response to growth hormone, crosses the blood-brain barrier, and may protect against Alzheimer's disease. The issue is that these things, especially IGF-1, decline with age. Can we get them back? Well, if you look at the muscle, if you look at the industry that's built around the aesthetics of weightlifting and of competitive bodybuilding, human growth hormone is one way to stimulate IGF-1. That's probably not the safest way to do this. The question is there a natural way to boost IGF-1 where levels begin to decline in the 60s, 70s, and certainly in the 80s? And how do we, those are the decades of life, how do we boost BDNF and IGF-1? So there's some evidence that IGF-1, which is is related directly to sarcopenia. BDNF is something that's related. The syndrome of IGF-1 impairment is something that's described in the literature as something associated with aging. BDNF, it's not such an age-related problem, but we know that it's something that comes from exercise, can be boosted, and can be helpful. But the question is, can we rescue IGF-1 really in people that are in their 80s even and 90s? Can we provide a program to the frail elderly, especially women, to see if we can boost IGF-1 and help protect against against the onset of dementia. So in partnership with the Bristol Assisted Living, we've begun we are far into a 6-month non-randomized study exploring the ability of strength training to combat frailty and build muscles for memory. So what we've been doing is we've been recruiting people living in the Bristol who are interested in participating in a strength building program. They get 6 months, twice a week. It's tough. I mean, this is a resistance training program with weights involved and incremental increases in stress adaptation cycles. And we are looking over time, every month, they get evaluated with, we look for biomarkers, things that are changing in the periphery, IGF-1, BDNF levels. We're looking for inflammatory markers, and we're rating them in terms of their frailty over time, and we're doing neurocognitive assessments. So the video here, I'm going to describe a little bit about the study and some testimonials from participants and how they feel about it.
Alzheimer's disease is a progressive neurodegenerative condition that affects people generally over 65. It begins with problems remembering things that happened recently, but eventually involves language, involves calculation, recognizing loved ones, behavioral disturbances like agitation. There are no treatments available that modify the disease itself. So I was very interested in participating in scientific research that might do something to change that. We know that seniors, as they age, they lose muscle mass and they become frail. The molecular mediators that the muscle produces may be one of the keys to improving memory. And we developed a Muscles for Memory program to look first to see whether we can make people who are frail, elderly, with memory impairments, can they get stronger?
I didn't have much strength to do things. I couldn't get up or move around without having the walker. At that point, I couldn't even stand without somebody holding me. I knew I needed to have my body change from the way I was. I've come a long way since then. My balance is better. My legs are much, much stronger. I can do things that I never thought I could ever do again, and that has been very encouraging.
It's possible to make the deconditioned, frail elderly stronger. This is something that can be done. We saw people feeling better, motivated, enjoying the interaction with the coach.
My coach is fantastic. A lot of encouragement, because things I said in the beginning, no, I'll never do that. I'll never do that. I did it, thanks to her.
The idea now is to take that program and expand it and look to see whether in a study of participants, can they get stronger and will that strength be associated with improvements in their memory so that patients don't progress anymore, but ideally reversing the process so that they recognize their loved ones again. That would be the ideal, that would be a cure.
It's very important to continue with other people so that somebody else might benefit by it, like I did. If the program could go on to help others, I think it would be fantastic.
So what you saw there is one of our participants describing the study, and you could see some of the exercise in action. And just to give you some of the highlights of what we know, certainly the study's far from complete, but we have had 33 subjects recruited, 23 have participated, and we have biologic and exercise data for outcome in those subjects. And for importance with, for keeping the women in mind, the majority of our participants have been women, over 80%. That has to do with the makeup of the assisted living population, and some of the courage of the women who are willing to fight for their health and get stronger. The mean age is 86 years old in our study, with people up to 97 participating in a 6-month strength study, which is not ever before been done. This will be totally new to the world literature in a group this old. And what you can see, I just want to present in the time that I have left quickly, some of the outcomes. So what you can see on this first slide, this is an 85-year-old woman with a history of hypertension, glaucoma, who participated in the study. And what you see on the graph there is we have traced her change in strength over time. Not always linear. Sometimes people went up at the beginning and tried to hold on to their gains, and life happens and things change. And sometimes there are setbacks, even in terms of getting stronger, but she's stuck with the program. And what's amazing is you can see over the 6 month period, drawing her blood, we can see that both IGF-1 at the top and BDNF go up. So we know the natural history of IGF-1 is as you age, it declines. Certainly in the 80s, it goes way down. This is someone that over 6 months, IGF-1 and BDNF both went up from participation. Her MMSE, this is a patient diagnosed with dementia. She has Alzheimer's disease. Her MMSE improved over time in the study. Apathy ratings improve. This is a second subject, an 88-year-old woman with coronary heart disease who had stents. We got clearance from her cardiologist to participate. Over the 6-month period, she had enormous strength gains, as you can see from the green part of the graph there. Her IGF-1 had a positive slope over time. Her BDNF was at least stable. Also a success story, depression ratings improved in her, anxiety improved, and her speed of processing, that cognitive corollary to the frailty syndrome, got better over time. This is a third subject, 87-year-old participant with coronary heart disease, atrial fibrillation, hypertension, hypothyroidism, diabetes, and arthritis. Look at what she did. Over 6 months, a lot stronger over time. IGF-1 and BDNF both went up. She had improved processing speed, phonemic and semantic memory. That means in terms of her language, her ability to generate words and remember words were better. Her confrontational naming, her ability to name objects that you hold in front of her, which is impaired in Alzheimer's disease. This is another person with Alzheimer's disease, and her working memory all improved. She had improvement of depression and anxiety. So the preliminary analysis of the study suggests, well, we know it was helpful. From a scientific standpoint, we have to put together all the data, look at some control subjects, determine what are the different parts of the background of the participants that most determined whether their IGF-1 went up, whether their BDNF went up, what influence did that have on their cognition, what is their memory improvement specifically, the memory improvement that we seem to notice in some of the subjects. What is the specific mosaic of that improvement? Is there a way that we can harness this? Is there a way that we can identify those people that will respond the most to this type of intervention? And how can we broaden it to offer it to a bigger audience? So we're continuing the study with the Bristol. We have a lot of data analysis planned. We expect to be able to put that out into the scientific community as soon as that data analysis is done. And for this audience, I guess my overarching, and I think Dr. Carney would agree, that many risk factors are not in your control. But investing in strength now will pay dividends later. This is one that really is in your control. So my advice is get out there and exercise, invest in your strength, get stronger, fight sarcopenia, reduce the risk of Alzheimer's disease. Thank you so much.
Hi, my name is Tracee Stanley, and I'm here to offer you a short rest practice. So allow yourself to just relax back. Maybe if you're in a chair, you can just lean back. Let your body be supported by the chair. You can also lie down just on the earth, however you feel most comfortable on your bed. And just allow yourself to come into your resting place, wherever that is. Take your right hand and place your right hand on your belly, your left hand on your chest. And just begin to notice that your body is breathing. Notice that your body effortlessly receives an inhale. And slowly feel the breath release from the body. Begin to notice that as the body receives an inhale, you can feel the belly expanding. As the body releases an exhale, you feel the navel contracting. Now just notice this rise and fall of your navel for the next minute. Navel rising as the body inhales, navel falling as the body exhales. Feel as though all of the breath is beginning to fill the space of the belly. And that this chest just becomes more and more still. You can even sense that the breath is becoming even. So the same length on the inhale as it is on the exhale. I'll count out the breath and you can follow along. Inhale on 1, on 2, on 3, on 4. Exhale on 1, on 2, on 3, on 4. Inhale on 1, on 2, on 3, on 4. Exhale on 1, on 2, on 3, on 4. Now do that on your own, just counting in for 4, exhaling for 4, on your own, just for the next few breaths. Now just allow your arms to rest out to the sides. Keep feeling the breath as it moves into the body, filling the navel, and feeling the breath release, and feeling the body soften. Become aware of whatever it is that you are resting on, and feel as though it is holding you unconditionally. So you literally feel the earth beneath you rising up to hold and cradle your body as the body inhales. And the body softens and surrenders and releases into that hold as the body exhales. Just notice that rising of whatever it is that is holding you, feeling as though you are being cradled and supported. And then feel the body release and surrender just a little bit more into that hold with the exhale. Just 3 more times on your own, feeling the support beneath you rising up to greet your body. Now beginning with the number 10, just begin to count your exhales backwards from 10 all the way to 0, feeling as though you are releasing and letting go with each exhale until the body and the mind are completely free. If you lose your place in the counting, just start back again at 10. Now, wherever you are in the counting, just come back and let it go. Feel as though you've taken these few moments just to rest. If you have more time, you can continue resting. Otherwise, the practice is now complete. My name is Tracee Stanley, and I'm so happy to have been with you for these few minutes of rest and relaxation. Have a beautiful day.
Hi, everyone. I am so excited to bring to all of you at the 92nd Street Y a woman that I met this past year that I was so impressed with, Lynn Posluns. She's dedicated her life to bringing the minds of women and their health to the forefront. And I think from the very first time I met her, I kind of felt that we were kindred spirits because we're both so passionate about helping women to better understand their bodies and their brain health. So Lynn, it's great to have you here to be able to share your knowledge with everyone. And until I met you, I must say, I had no idea that women are, let me get this right, women are twice as likely as men to develop dementia, and almost 70% of new Alzheimer's patients will be women. And then to learn that most of the brain research has always been done on men. Like, how can that be?
That's a very good question. And that's one of the reasons why I founded Women's Brain Health Initiative, was exactly to understand why women are more susceptible to brain aging diseases like Alzheimer's, the most common cause of dementia. And then, like you mentioned, why is the research focused on men? I tried to understand that to see if there was a rational reason why, but there wasn't. So, I founded this charity really so that we could level that research playing field.
Well, I had heard about, I think it was called bikini medicine or bikini research, mainly in terms of cardiovascular disease, when, the surprise, you can't take all the men's research on these big, strong guys and apply it to women's bodies who have hormones. But somehow brain health was just never caught up with that.
Right. So the idea behind bikini medicine is anything the bikini covers, of course, they're going to look at by sex and gender. So they're going to study breast cancer and menopause and pregnancy and ovarian cancer. But the philosophy was, if it's easier to study the male because the hormones don't get in the way, then can you look at the male and apply it to the female? So as you mentioned, in terms of heart health, they recognized about 20 years ago that a man's heart attack and a woman's heart attack may present differently. And so they were, missing a lot of women who were going into heart failure because their symptoms may have presented differently. And that's when they started to suss out, is there a difference in what those differences are? Well, there seems to be something going on in women's brains that make them more susceptible to brain aging diseases than men. But again, if the research is focused on men, I can understand why.
And obviously, just because we're more complicated to research doesn't mean you don't have to research us. But I'm sure that some people, when they hear these stats, women are twice as likely to get dementia. Could it possibly just be due to the fact that we live longer, so that we have longer time to have things break down?
Yeah, there's no question women do outlive men, but even discounting for age, they have found that women still suffer from these brain aging diseases more than men. So again, the more reason to study women versus men to understand why that's the case. Now, we are starting to learn a bit about why that could be. It could be hormonal. And again, if you're not studying women, you're not going to understand the role that hormones play. So estrogen, for instance, we know is neuroprotective. And as women go through menopause, they lose the neural benefit of the estrogen. But men continue to produce estrogen because the testosterone converts to estrogen in the brain. So I think hormones is one thing that has to be looked at very carefully. But there could be other causes, and they need to understand what those are. I'll give you an example: sleep. And you've written about this. Sleep is very important to protect your brain health. It helps consolidate memories. It helps remove the toxins in the brain. And if you're not getting enough sleep, and we know women don't tend to sleep well, when they have kids, they're, babies, they keep them up at night. Teenagers like to talk to you in the middle of the night, so you got to be on your game. And of course, once you go through menopause, you're not sleeping well. So is sleep a problem. Women suffer from stress differently than men. Women are twice as likely to have depression, anxiety. Those things, if left untreated, can lead to dementia. So these are all the things that we think the science has to dig into deeper.
And it's interesting because you mentioned sleep, and you and I have talked about this. Women are more likely to take Ambien, right? And tell us about what effect that has on the brain.
Yeah, and I learned about this a few years ago, but women seem to get into more accidents early on in the morning, and they
Traffic accidents?
Car accidents, because if they had taken Ambien the night before, which is a sleep aid, it continued to be in their system early in the morning. And it wasn't until they started to understand why these women were, in more car accidents than men were, that they started to understand that maybe the drug was synthesized differently in a woman's body than a man. And they ended up reducing the dosage for women than they did for men. And this is important because, when you have a child and they're giving them an antibiotic, they do say, how much does your child weigh? So they can determine the amount of the antibiotic. Now, women's bodies tend to be smaller than men's. So you would think that even that alone would perhaps require a different dosage for women than men. But again, they have to understand that. Yeah.
And they might have more fat to ratio to muscle, so it metabolizes differently. I mean, I read where Alzheimer's has moved ahead of cancer as the most feared disease. And of course, we have seen mortality rates go down in areas of like diabetes and cancer and heart, but not the brain.
Not in terms of Alzheimer's. They haven't found a drug, a medical intervention that cures Alzheimer's. They do have some drugs that help with some of the symptoms, but because they have not found a cure, we also have to look at what else we might be able to do that will help ourselves and our loved ones. And what the science is starting to show is that, in fact, there are preventative measures that everybody can take, men and women, that can help delay and possibly prevent the onset of diseases like Alzheimer's. Well, that's pretty significant.
Yeah.
And people have to understand what those prevention methods are.
So I want to go through those because a couple of things you taught me that by the time we see the symptoms of Alzheimer's, the damage has already been done like 20, 25 years prior. So that tells us that we have to be thinking of this much earlier on. And you also say 1/3 of all cases of dementia can be avoided by making lifestyle changes. So that's empowering. So let's go through those.
Okay. Yes, and this was a very important study that came out of the Lancet Commission out of the UK, which said that up to 40% of all cases of dementia can be avoided by your lifestyle choices. Well, if you had a 40% chance of winning the lottery, wouldn't you go buy a ticket? I mean, that's a huge amount of prevention that we can control ourselves. So like you said, it is empowering. We got to know what those are.
So there's 6 pillars, right? What are they?
Yeah. So we talk about the 6 pillars of brain health, and all of these, especially cumulative, can help protect you, because just because you have a genetic predisposition doesn't necessarily mean you're going to get Alzheimer's. And if you don't have the gene, you can still get Alzheimer's. And this talks to the importance, again, of lifestyle. So what are those 6 pillars? Mental stimulation. You have to exercise your brain like it's a muscle. And it's all about new learning. Of course, the more complex, the better. So learning another language, learning to tango dance, learning a musical instrument, but it can be simple things too. Like if you're right-handed, brushing your teeth with your left hand, driving a different way to work every day. These things help develop new neural pathways. So as one part of your brain starts to fall off, another part can take over. So mental stimulation, very important. Ongoing education. Exercise increases the blood and oxygen flow to the brain. So you have to exercise your body to exercise your brain. Nutrition.
Before we leave physical exercise, you brought to my attention some amazing research being done by Dr. Pauline Mackey, I believe, out of Chicago. And she says exercise in your 20s is going to have the biggest impact on your brain health in your 70s or 80s. How is that so?
Actually, it was a study that was done in the US that did talk about the decade where exercise impacts the health of your brain and your cognitive health when you're in your 70s and your 80s. And it was exercise in your 20s. And this was done through neuroimaging where they could see the benefit. Now, just because you're past your 20s doesn't necessarily mean that it's game over. But the earlier you start, I think that the point here is that the earlier you start with these healthy lifestyle choices, the stronger the protective effect will be.
All right. Social interaction, having friends.
Yeah, so this helps reduce isolation and depression. And as I mentioned earlier, those can lead to dementia if left untreated. So staying socially active, particularly tough over the last 15 months for people. I mean, this is another way you can stay socially active is through the use of technology like Zoom. But yeah, staying socially connected, very important for your cognitive health, as is stress reduction. And chronic levels of stress can prematurely age all your cells, including your brain cells. And
say
there's
that one more time.
Yeah.
High levels of cortisone, I guess, in your body
yeah.
prematurely ages your cells.
Yeah.
Wow.
Yeah. Yeah.
You know,
So there's different things you can do. Meditation, mindfulness meditation, they say is great for stress reduction. Yoga is really good. Adult coloring is a fun thing to do. And it's a bit, can be a little bit like meditation. It may be shopping for you if that reduces your stress. Whatever you can find to keep your stress in check is very important to protect your cognitive health.
And then, of course, you know, is nutrition, because, you know, all the fitness instructors will say you can't exercise your way out of a crappy diet. I mean, it's not possible. But nutrition actually really impacts our brain. Like I think you said, healthy gut, healthy brain.
That's right. Inflammation in the gut has shown to be inflammatory also in the brain. The best diet, so to speak, is something called the MIND diet. And this is a combination of the Mediterranean style diet. So fruits, vegetables, nuts, olive oil, fish, lean proteins, combined with the DASH diet, which is low sodium to control hypertension. It's a fairly easy diet to follow, and this is proven to be beneficial to cognitive health, even if you're in the early stages of dementia.
Wow. Now you mentioned hypertension. So let's talk about some of the things that can increase your risk, like high blood pressure, right?
Right. High blood pressure, high cholesterol, obesity, a sedentary lifestyle, smoking. Smoking causes oxidative stress in the brain, which is damaging to the brain. There's no level of safe smoking for your lungs or your brain.
And another one that you brought up to my attention was having a hysterectomy and having your ovaries removed. Now, because I had no idea that could increase your risk of dementia. So I want to talk a little bit about that.
Yeah, so if you have a hysterectomy and both your ovaries taken out before natural menopause.
Before natural menopause, so that's
goes into menopause very quickly. That can be problematic to your cognition by as much as 200%. So huge. And this sort of makes sense, right? You remove a body part, other parts of your body can be affected. So if you have to have your ovaries taken out for whatever medical reason, okay, but what are you going to do to shore up the problem? You know, and understanding that there is this connection is very important, particularly for young women who, you know, need the hormones that are released because of their ovaries.
Another thing that I was really fascinated by and had never really thought about is that when they test you for dementia, almost every test will do one thing the same. They'll start and they'll give you, I think it's 10 words, and they'll say, okay, remember these 10 words. And then they test you for, I don't know, 30, 45 minutes. And at the end, they say, what were those 10 words? And anyone that's been tested probably knows that. But why is it so different from men to women with that one little nuance?
Well, this is actually research that Dr. Mackey made me aware of. And what it shows is that women, by the time they forget that list of words, they're actually further down that slope towards Alzheimer's dementia than a man is when he forgets that list of words. So in other words, if the tests are the same for men and women, this is again, when we talk about the nuance of the research and looking at it differently. If a man remembers those list of words longer than a woman would remember. But at the time she's diagnosed, she may be, again, too far progressed compared to a man who loses that list of words, remembering that list of words. So again, maybe the testing has to be done differently, men to women. So whether it's cell behavior, whether it's care at the bedside, whether it's clinical studies, the science must look at men and women differently.
So because we do better on that, which is probably why we're good multitaskers, right? Because we can remember all those things. Boy, we have that list going in our brain. It could get it's not really even misdiagnosed. It's just not diagnosed. And we do now know, to leave everybody with some positive input here, besides all the things that, Lynn's just talked about, that we can all do, making little changes in our lifestyle. There are also now medications and interventions that are becoming known if you can, when you're diagnosed. So the earlier you're diagnosed, the better, right, Lynn?
Correct. That's exactly right. So again, what are the tests? And the tests have to be different men to women because their symptoms may present differently and at different stages.
So if you had parting words for everyone here, what would you say are the most important things that women can do to slow down cognitive decline?
Well, both men and women, but I would say these 6 pillars. So mental stimulation, exercise, nutrition, sleep, 7 to 8 hours every single night. Missing a night doesn't count. You can't sleep 10 hours one night and only 6 hours.
Oh.
You got 7 to 8 hours every night. Social engagement, like you said. Okay, so mental stimulation, exercise, nutrition, sleep, social engagement, and stress reduction. And again, we have more control than we may have realized. So take these 6 pillars, understand that things can increase your risk, other things can decrease your risk, and take some control because everybody wants to ensure that they maintain their cognitive vitality as long as possible.
Yeah, we're all living 10, 20, 30 years longer. And the whole objective is to try to slow down any cognitive decline so that those are better years. So know that when you put on your sneakers, it's not just about being able to get into a smaller pair of jeans. It's because you're pumping blood and oxygen and nutrients up to your brain and creating neurogenesis and slowing down cognitive decline. That's what gets me to put on my sneakers every day. And by the way, put those sneakers and that exercise gear on early in the morning. It will make you much more likely to get in some exercise. Otherwise, at 4 o'clock, you look down and like you can shame yourself, but it can't just be all about talk. We need to eat clean. We need to get that exercise and do everything we can so that we can be the best that we can be. And Lynn, I got to thank you for all the important information you've imparted today. And also just for all the work that you are doing to make sure that brain research is done specifically on women.
Thanks, Joan.
All right. Thanks, everyone.